This is a wonderful crowd. I am so happy to see all of you here. It's really gratifying. So, welcome everyone to Bellingham City Club. I've been really looking forward to today's presentation, Expanding Possibilities in Healthcare. And we have our esteemed speakers, Matt Ellsworth, who is the Executive Director of the Association of Washington Public Hospital Districts, and John Scanlon, who serves as the at-large council member for the Whatcom County Council Vice Chairperson, and the chair of the Whatcom County Board of Health. My name is Allison Roberts, and I am the board president of Bellingham City Club, and I welcome you here today. I love our mission to inform, connect, and engage our community to strengthen the civic health of our region. Thank you everyone who has come here today and brought a guest, purchased a ticket, or planned ahead to be here. And if you know someone who is not here but would be interested in this topic, the video of this presentation today will be on our website early next week, and I encourage you to share it. As always, I'd like to thank the volunteers, and there are lots, who make our programs possible. In particular, our program committee works months and months ahead of time. Sometimes they're 6 months, 7 months out, trying to secure speakers and work through the logistics. So a big thanks to them and to all of the volunteers. We just calculated that we spend about 200 hours a month bringing these programs to you, more than 2,500 a year. That's a lot of volunteers to thank. And I have a big thank you to our caterer who pulled out a beautiful meal today. Good bowls. Our videographers, Talking to Crows. Yay. And our sound engineer, Sea Level Sound. They make the sound so much better than it was before. So thank you all for making this a quality program. And of course, thank you to Bellingham Yacht Club for providing this gorgeous venue. So your support makes this program possible today. Recently, we've done a deep dive into the value that we provide our community. And surprisingly, when we look at all the numbers, hosting a program like this with a room rental, our wonderful videographers, and the sound engineering costs about $1,500 a month. And that's covered by our dues, our generous donors, grants if we can get them, and sponsorships. Your meal today barely covers the cost of your ticket, or your cost of your ticket barely covers your meal. And we love our meals. It's a wonderful way for us to gather together in community. And where else do we ever get to do that? Talking with people that we don't know, neighbors that we might not meet in other places. So it's a really important part of City Club to have a meal together. If you're not a member, we invite you to join, and you could support our 30-year legacy of bringing these conversations to Whatcom County. And if you are interested, you can talk with our treasurer in the back. His name is Zach, and he'll be happy to take your money. Or if you want to do it, you can go ahead and just sign up online. But I highly encourage you to do it. It's a nominal fee, and it really helps us support this quality programming. If you're interested in joining the City Club board, you can talk with me or any of the other board members that are in the room. Can we have the board members raise their hand really quick? Got Jim, Jane, Kit. Yeah, we've got a few. Oh, I see one more there. Hi, Mary. So before I begin, I want to make sure that we express our deepest respect to our indigenous neighbors, the Lummi Nation and the Nooksack tribe, for their enduring care and protection of our shared lands and waterways. We honor that the land that we are on today is on the ancestral homelands of these peoples, the Coast Salish people. And their presence is imbued in the waterways and shorelines, valleys and mountains, which we cannot see today through here, but since time immemorial. I would like to get started because we have quite a program today. And I would introduce Garrett O'Brien, who's a member of our program committee and president and owner of Volanta Corporation, a full-service general contracting firm. Welcome, Garrett.
Thank you, everyone. I'm going to keep my water handy because I'm kind of nursing a sore voice. In addition to my work duties and other civic activities, I'm also the head wrestling coach at Bellingham High School. We just got back from the state championship meet at the Tacoma Dome, and I did a lot of screaming and yelling. So thanks for bearing with me. Well, good afternoon, and on behalf of the Bellingham City Club, I'd like to thank you, all of you, for joining us on this important program. Today's program is titled Expanding Possibilities in Healthcare, which is a simple but accurate description of what we are hoping to achieve with this program. The underlying questions are, in Whatcom County, are we getting the best health care available? Do we have blind spots in our current delivery system? And what can we learn from other models, such as public hospital districts? To help us answer these questions, we're pleased to have two distinguished panelists who have a passion for community health and have dedicated much of their professional lives trying to improve outcomes in the increasingly complex structure of what we generally call our healthcare system. Allison already briefly introduced them, but please join me in welcoming Matt Ellsworth, who's the Executive Director of the Association of Public Hospital Districts, where he leads statewide advocacy, governance support, and strategic initiatives for Washington's public health hospital districts. His work centers on strengthening community-owned health systems and partnering closely with the Washington State Hospital Association to advance policy and operational excellence. He serves as the chief leader of the organization, guiding advocacy, education, and member services for Washington's 58 public hospital districts. Thanks for being with us, Matt. We appreciate it. Also, please join me in welcoming our second panelist, John Scanlon, serves as the at-large council member on the Whatcom County Council. He's council vice chairperson and chair of the Whatcom County Board of Health. He has 20 years of experience in public policy and advocacy at the local, state, federal, and global level. As a consultant, John assists organizations with rights-based public policy and advocacy work. John has a Bachelor's of Arts from Emory University and a Master's of Science from Sam Nunn School of International Affairs at the Georgia Institute of Technology. John and his wife Jennifer, a local obstetrician, live and call Bellingham their home. Thanks, John. Thanks for joining us. Before Mr. Ellsworth and Councilmember Scanlon begin with their prepared remarks, I would just like to acknowledge that when it comes to our health care or the care of a loved one, we often have deeply personal and emotional experiences that are inseparable from the outcomes that we receive at a hospital or a clinic. In healthcare, we often talk about systems, policy, insurance plans, regulations, and the cost of care. And oftentimes we're disappointed with our healthcare system. However, I think it's important to remember that at the level of the delivery of patient care, we're not dealing with systems, but rather people. Nurses, technicians, and physicians who are our neighbors, our community members, and our friends. In acknowledgement of this very human and community level connection, I'd like to emphasize that this program is not intended to be a rejection of any existing service provider, nor the appropriate venue to air grievances of personal experience. When we get to the question and answer portion of the program, we respectfully ask that the questions are focused on the material that's presented by our panelists and help guide our learning as we explore ways to expand possibilities in healthcare. I'll now turn the program over to Mr. Ellsworth. Thank you.
Great. Well, thank you, Garrett. I appreciate that, and thank you all for having me here today. Again, I'm Matthew Ellsworth. I'm the Executive Director of the Association of Washington Public Hospital Districts, AWPHD. Part of my goal here today is to have a conversation with you a little bit about what is a public hospital district. Why does it have this funny name when you don't have hospitals? What does it mean to you as patients? What does it mean to you as taxpayers? And as residents of what may be a future district? Part of our discussion today is going to be a little bit of myth busting. as you probably gathered from my first sentence, and talk to you a little bit furthermore about how they work and part of their establishment. My colleague on the stage today, the good councilman and I, we've talked, we're going to dedicate a lot of time today for that discussion, for that back and forth, to hear your questions and to answer your thoughts about what this thing is. So what I'd start with is a little bit, what is a public hospital district? Washington has a lot of them. We have 58 now here in the state of Washington. We have 2 that have been created within the last 5 years, and I'll come back and talk about those. And of those public hospital districts, they're their own governments. Think of them like a school board, or like a fire district, or a library board, or my favorite, the mosquito abatement district. You elect your leaders. The leaders are lay people, your friends and neighbors that get elected for up to 6-year terms, and they will run the district in each and every way. Once they're elected, they will select a superintendent, some people call them a CEO, and then they will administer the work of the district itself. There's going to be a circle drawn around wherever you may choose or choose not to establish this, and that you can't overlay another district. Who here knows how many districts, now there's 2 of you can't answer in this room, how many public hospital districts exist in Whatcom County already? There's 2. Believe it or not. There's a public hospital district in Point Roberts. Well, why not? And then there's also a little piece of the district, it's called United General 306, that's down below in Skagit County that just reaches over for a little bit into your county. The rest of it does not have a public hospital district. So legally and technically it's open to be a district and created a new space. They're self-governed. And so why were they created? They originally came out of around the 1940s and 50s. The only 2 states with more districts than Washington are Texas and Florida. They used to be all over the West because it's that Western spirit of self-determination. We live in a healthcare desert. Nobody wanted to open a hospital where we live, so the community got together and said, we're going to tax ourselves and we're going to create a hospital district, and we're going to find a way to bring healthcare to our own community. And that was the original generative idea of public hospital districts. Just like when you said, hey, we need a firehouse. And then you got a volunteer set of firefighters that came together that eventually became a fire department and eventually became what may be an urban area later. Most public hospital districts are in rural areas around the state of Washington. Our 4 largest public hospital districts, 2 of them are in King County, in Renton and in Kirkland, and they're very large hospital operations. The next are in Port Angeles, and then right to the south of you here in Mount Vernon are all public hospital districts. After that, they get pretty small when it comes to operations. Now, this is where the exciting part comes, is that a public hospital district does not have to run a hospital. So why did you put it in the name? Of those 58 public hospital districts, only 40 of them operate hospitals. Because under the RCW, the law here in the state of Washington, a public hospital district is charged with one thing: providing health care to district residents. So it can be a wide variety of things. We have hospital districts that run an EMS service. We have hospital districts that run nursing homes. We have some that run clinics. And then we have some that simply do none of the above. They're a catch-all organization that may either A, have a partnership with a hospital they used to run, where they said, in the case of United General and the Skagit, the district said, we don't want to run this hospital anymore. It's beyond our capability. It's beyond our financial means. And so they create a partnership, in that case, with Peace Health. Down in Edmonds, what's now called the Verdant District, they decided that they no longer wanted to run a hospital, and Swedish now runs their hospital there, and they actually get a lease payment off the buildings they own. And so we have these creative organizations all around the state. In Kennewick, in Vashon Island, and down in Arlington, what they do there is they provide money for mental health counselors in the junior high. Senior programs, again, anything under that catch-all for the benefit of the district residents for healthcare. They're able to levy taxes. And so what, just like a school district or anything else, they have a cap. I'm not going to get into the math of all of that. But then they collect that money. And so when they do decide to say, okay, we've created it, the voters have said yes, there are only two ways to create a public hospital district. One, by the voters themselves, and there's a little known function where the state legislature can create it. And it's only been done once in this state. And even then they had to go to the voters eventually to create it themselves. But the legislature said, we will give you some money, but you must convert to a public hospital district. That was down in Aberdeen. So once they're created and they get that tax money, they can, like a school, they can pass a bond to build a building, get a mortgage, or they can pass an operating levy that gives them money to operate every year. What we have found is that what can they do? Okay, they can do anything under that healthcare umbrella. Now, you can't get too creative. We've tried to say, well, housing is a critical healthcare need. I think we all believe that to be true. But eventually they've said, no, you can't do that. It has to be more direct related to healthcare itself. And so whatever you believe that if you want nutrition programs, if you want to open a clinic, if you want to create a partnership with somebody and say, hey, we're going to give you a little money so that you're incentivized to come and provide whatever line of care, maybe in a rural corner of the county, you're able to do so. Let's talk about what they don't do. So when a public hospital district is created, they only have authority over those things that they choose to operate. They may have an interlocal agreement. You may go and say, okay, Point Roberts, we want to tie ourselves together as two units of government and share resources. You may want to share back office building or something like that. You can go to CMAR, you can go to Neighbor Care, you can go to Planned Parenthood, you could go to Peace Health and say, let us run a clinic together over in the southwest corner of this community so they don't have to drive for primary care. And you can intermingle your funds in a contractual way to do that. They do not run your public health department. Your public health department, you're on the board. They are still a standalone function. They are typically tied to your county. That still will do infectious disease. They will still do community programs, but you can partner together and work together. But at no time can the public hospital district say to public health, you must do this. The public hospital district cannot, if it's drawn around an existing hospital. So St. Joseph would be in the middle of this new district. The public hospital district has no authority over St. Joseph. They can't tell them what to do, can't tell them what not to do, who to hire, and how to deliver care. They have no policy function over them at all. However, if they choose to partner together on, let's say, a clinic somewhere else, the district could, in a contractual way, say, well, these are the core tenets of how we're going to behave underneath this partnership. And then, of course, whatever other organization would have to agree to those terms as well. So it's you don't have an overriding authority over anybody else. And then finally, what they don't do, quite frankly, anymore is build hospitals. I would say that as this conversation evolves, and it's involved in a wonderful way here in the county, thanks to John and a lot of folks in this room, is that because it's called a public hospital district and you see it on the ballot, a lot of your voters are going to feel like, oh, I'm voting to build a hospital. That's not true. And I'm going to tell you why from a few facets. Now, I haven't seen the ballot language. If whoever decides to put this forward says to you, we're going to build a hospital, I would step back and take a closer look, quite frankly. And I'm not saying that as a matter of competition with the current hospital or what have you. The money's not there. A public hospital district could build a hospital with taxpayer funds back in the 50s. I've seen the math behind this. At the highest end amount of money that this would raise, probably could not build one clinic within a hospital itself. Healthcare is incredibly expensive. As an example, even in our largest community, take Kirkland, Washington, high property tax area, they have they're up to almost the cap in their levy rate. That only equates to 2.2% of their revenue is what they get from taxpayers. So when it comes to operating a hospital itself, quite frankly, what the taxpayer's contribution to the healthcare needs is not enough to operate a facility. Now, is it going to be enough to operate a clinic? Yes. Is it going to be enough to incentivize a partner, CMAR, Neighbor Care, Peace, Multi-Care, pick any of the above and some I didn't mention? Yes, it is. It makes you a very attractive partner to come and bring those resources that you as a community need to say, we have a desert here. We have an area of care we're not getting, and we would like to bring it to us. And this is our vehicle to do that, and this is our incentive to do that, which would be those taxpayer dollars. So I would say that going forward, this is the big myth bust we're doing here, is that when people see hospital district, they immediately go and say, oh, we're going to have a shiny new hospital. That, quite frankly, just isn't the case. So how do they work well? And this will be my last part here. Why are public hospital districts good enough to have an association? Interesting enough to have a guy in a cowboy hat come up from Seattle and talk about it. What works really well in public hospital districts is good governance. So when you create a district, you also create, and they could choose a number from 3 to 9. It will probably be 5. You're going to elect 5 individuals to govern this. Pay attention. Who are those 5 people? Are they right-minded? What do I mean by that? Is it in their heart to provide health care to their community? Are they running for the right reasons? Because we all know the glory and fame that comes with local office, John. He has donned his toga. He has walked into the forum, people. This is public service at its core. And so are the people you electing, do they want to advance healthcare in the right way? Are they coming in this with an ethos of partnership with those who are already providing healthcare in your community and not looking to divide? There are models out there that work well. I mentioned some earlier, Verdant, down in Stille Valley is what they call the one in Arlington, Vashon, Kennewick, some of these others. There are models out there to say, we have some money, we're not going to build a hospital, but we want to use this as a catalyst to bring those healthcare functions and then start doing that in a way that are out there. And then finally, what's really attractive about a public hospital district model is the transparency. I mentioned earlier your neighbors to the south down at Skagit Valley Regional Healthcare, a wonderful organization. If you want to know how much money they've spent to paint the parking lot, they have to tell you. At every board meeting, it's open to the public. You can show up at a board meeting on every decision and say, I'd like to have my voice heard. And so the public has an ownership of their healthcare in that way, and a vision and a transparency that is really something special. And I'm not saying that to besmirch our friends that are not public. It is one of those things that it's the core of what we do in public service. And so that's a quick overview about why and how we do public hospital districts. I think why they matter and why they're a little unique. I know John's gonna talk a little bit here, and then we're gonna have some discussion about some of the mechanics, about how it gets on the ballot, how they get funded. I'll save those because I know they're gonna come up in the questions later. But with that, I think that's a good start and a primer to the public hospital district world and what this funny little thing is that everyone's buzzing about here in Whatcom County. So John.
Thanks, Matt. There we go. Now I'm on. Whoa. Sorry about that. Hi, everyone. My name is John Scanlon. I do serve as your Whatcom County Council member, Chair of the Board of Health, and Vice Chair of Council. I just want to make clear today I'm here in my personal capacity in doing this work. This is a bit of work I've been doing outside of the council work. It's so good to see so many friends here in this room today, from Ski to Sea teammates who are here. We're on the wait list, so if anybody's thinking about getting off, get off so we can get on. We did get on last year. We're the waitlist all-stars. And so many friends I've worked with across our community, from my fellow council member and our chair of our county council, Councilmember Galloway, who's here today. Thank you for being here. I see folks who are members of our county's Public Health Advisory Board, so many leaders in healthcare and public health in our community who are here in this room today. Thank you so much for coming. I'll talk a little bit about my personal story and how I came to this, some of our community story, and then what we can do. So personally, healthcare was one of the reasons why I ran for office. I grew up and live in a healthcare family. When I was young, my mom was a nurse. Her sister, my aunt, was a nurse when I was growing up. My grandmother, who we lived with when she was in her 20s and 30s, was a dental assistant. She actually wanted to be a dental hygienist and go to school to be a hygienist and couldn't do so. Her family couldn't afford to do so due to medical bills for her father. So she became a dental assistant, worked in a dental practice for a number of years before becoming a realtor. My grandfather was deputy fire chief in my town, in my hometown in Western Massachusetts. And they were one of the early fire departments that had an emergency medical services unit and had ambulance services in their unit. My mom described it as kind of like the ambulance from Ghostbusters and looking like that. But I remember it growing up when I was young, and I was talking with my mom actually earlier this morning, and she was telling me that part of the job, the ambulance and the EMS service, was my grandfather's favorite part of his job in serving his community. And then I married a doctor. So my wife is an OBGYN. We met when she was a first-year medical student. And so we've been together since then. So I saw her go through medical school, residency, go into private practice, and now working in our community. So I have a lot of healthcare stories and healthcare workforce stories. I grew up around those stories. I live those stories today, and have my own stories as a patient. And I'm sure so many of us do as well. Maybe as you are coming to this event today, or as you're sitting here, you're thinking about your own healthcare story. One of the things on my mind is I have a very medical procedure tomorrow morning. So that's one of the things on my mind today. I'm sure many folks in this room are thinking about their healthcare story. And we have a community healthcare story as well. And so in Whatcom County, in the work that I've been doing for the past few years, from going across this county when I ran for office in 2023 in an at-large seat and visiting every community in our county, from Point Roberts and their public hospital district to New Halem and the Seattle City Lightworkers there, who have a public hospital district, and everywhere in between, healthcare is always one of the top stories and top issues that people ask about. Sometimes in county government, we think about, well, what can we do? What's our role? And there's a lot that we can do, and there are items that people have been documenting over the years. I want to thank Owen Racer, who's in this room from Cascadia Daily, who's been covering a lot of this and telling those healthcare stories. There's been a lot of good work on this over the past few years. One of the things I also think about is I'm in my mid-40s. I'm in that sandwich generation where a lot of my friends my age are raising their kids and are worried about youth mental health care. We've been presented in our county council and our board of health about some of the youth mental health rates around suicidal ideation in our schools, and we have some of the worst rates in our public schools here in Whatcom County. One of the things I've been reading about and hearing about recently from parents and teachers and school administrators, in particularly in East Whatcom County, after the recent floods in December, is they're seeing those rates of the need for youth mental health skyrocketing in schools, and particularly in the Nooksack Valley School District. Friends in my age are also helping out their parents. And my wife and I went through this a few years ago in the middle of the pandemic, when the day that California was closing everything down, we had to drive down, go get my father-in-law, and bring him here to be able to access care. So a lot of my friends, these are our conversations that we're having, is what are we doing for our youth? What are we doing for our parents? And how can we help? A lot of the healthcare needs in our community have been identified through numerous reports. And I'll list some of those here. For example, our county health department every 3 years goes through a community health assessment and a community health improvement plan. The county health department also a few years ago launched a new data platform. If you haven't seen it before, it's the Whatcom Community Health Insights platform that has a lot of the data in our county on healthcare and public health. Peace Health St. Joseph's goes through their regular community health needs assessment, which also looks at our community health needs. Looking at senior care and elder care, the Aging Well Whatcom group has done a lot of great work identifying needs for seniors in our community. And our county's Whatcom Racial Equity Commission has documented racial equity issues in healthcare and health outcomes in our community. In some of our recent County Board of Health meetings, we've been inviting in community organizations to talk about locally led healthcare initiatives and public health initiatives. And we've heard so many great stories and about their need for more funding. One of the recent stories we heard about was about Growing Veterans, which has a farm up on Guide Meridian, just south of Weiser Lake, where they work with military veterans to help with their mental health needs by getting in the dirt and working the soil. We also heard from groups like the Health Ministries Network and the Ask a Nurse program, which goes around to senior centers and food banks across our community to provide that preventative care right on site, right in community where people live. There are so many great programs that folks are leading on across our community, and they need help. So all this work, all these reports I cited, and all this work has documented so many needs in our community. And you can look across these reports and find needs in behavioral health, substance use treatment and care, youth mental health, homelessness, healthcare workforce needs, primary care access, preventative care, specialty care, access to dental care, food insecurity. I could go on, and I'm sure so many of you have stories as well. There are some really good things going on in our county and in our community. And so one of the areas where we have a lot of good work going on healthcare and public health access is in East Whatcom County. So a few years ago, Chuckanet Health Foundation applied for a grant with the State Department of Health to create a health equity zone in rural East Whatcom County. So the state legislature created a program where they were going to fund this work in 3 parts of our state where we have health equity needs. And they identified 1 urban area, 1 rural area, and 1 tribal community. East Whatcom County was that rural area that rose to the top of having health equity needs. That work has been going on for the past few years, and there's now a community board in East Whatcom County identifying needs for East Whatcom County. I'll talk a little bit about some of the things going on, some of the drivers at the federal level, state level, and local level. I think we all are aware of some of the changes going on at the federal level, where H.R. 1, which passed in Congress last year, signed by the president, is likely going to lead to significant cuts in Medicaid. In Whatcom County, we have about 55,000 people who access their health care via Medicaid in our county, and our health officers at our county health department are estimating up to 9,000 people may lose access to Medicaid in our county. At the state government level, there are persistent threats to cutting support for county health departments, which do so much of that public health work in our community. And that's something that our county council has been fighting. We passed a resolution on that last night. Signed it today. Thank you, Chair Galloway. And we'll be advocating to make sure that those resources are coming in to our community. At the local government, we've got some good work going on. For example, the Healthy Children's Fund that's helping out with childcare access in our community. And we have our behavioral health fund that we're funding behavioral health programs. One of the things we did in county council recently is we said yes to a new behavioral care center, which will be located in Bellingham's Iron Gate neighborhood. This will be paired with the new jail to provide behavioral health care in our community. We have challenges as well. Most of our county funds and most of the city funds of the 7 cities in Whatcom County just can't keep up with inflation and labor costs. So we've got some challenges there. Tribes in our community are doing great work. I don't know if anybody's driven through Lummi Nation recently, but you're seeing the expansion there of their tribal community care and clinic there. Nooksack Tribe is looking at some things as well, and you may see changes in Deming in the next few years, adding more healthcare in Deming and in the community. The Swinomish tribe has been partnering with Whatcom County and with other counties on behavioral health, and we're seeing great partnerships there with the Swinomish tribe. We're seeing people come together to develop these solutions, and I've been in meetings with many folks in this room about what are we doing about these cuts to Medicaid? What are we doing to devise solutions for our community? So there's so much that we can do, and so we're looking at what are other communities in our state doing, and public hospital districts is one of the things we've looked at. So we look at what are some of the other communities doing in our state. They're using public hospital districts to support rural healthcare clinics, wellness classes and public health education programs, charitable healthcare services, in-home care, assisted living, healthcare workforce work such as recruitment and retention bonuses for rural clinics, and subsidizing local hospitals and clinics. They're doing this through local funding, local decisions, and local action. And they're doing this through PhDs, public hospital districts. So I first learned about PhDs when we moved to Washington State. So my wife, the first job that she had was at King County PhD 1, Valley Medical Center in Renton. That was the first place she worked in Washington State. She now works for Skagit County PhD number 1, which we also know as Skagit Valley Hospital or Skagit Regional Clinics. So I learned about PhDs 16 years or so when we moved to Washington State and have been studying them for some time. Started some of these conversations when I ran for office in 2023. We did talk then. There's other folks I see in this room that I've talked to since then as well. We've seen some good action in our community. The League of Women Voters has been studying this and held an event that I think, Matt, you may have attended remotely some years ago. There's also good folks in this room. I see my friend Morgan, who created a website to share information about public hospital districts. WhatcomPublicHospital.org is the website. You can check it out and get more information there. And since late last year, a number of us have been meeting to look at what might a PhD look like for Whatcom County and when should we potentially put that on the ballot. So we can talk a little bit more, I think, in the Q&A about what it might take to create a public hospital district. But in Whatcom County, what it would look like is getting 17,000 people, roughly, to sign a petition to say, yes, we want to put a public hospital district on the ballot. And then it goes to the voters. And the voters can vote it up or down. And they would also vote on those commissioners who would then oversee the budget and the levy rate for the hospital district. So looking to the future and some of the things we can do, what we're looking to do is build a team. I've got a sign-up list right here. We're looking for folks to come help out. And I also want you to talk with my friend Selena. Selena, if you mind waving your hand. Selena has a sign-up list as well. There's other folks in this room who've been involved as well. So I've got 2 questions for folks here to think about. Come up and let me know if you've got answer this or in the Q&A. 1, what do you think we should focus on? What do you see as the healthcare needs in our community, in our county? And 2nd, do you want to be involved? If you want to be involved, come talk with me, come talk with Selena. I'm just going to end with 2 quotes. So one is, my wife is a big Taylor Swift fan. So I'm like a Swiftie, by association. Swiftie adjacent. So one of the lines, the 2019 song Lover, which starts up with, we can leave the Christmas lights on until January. Does anybody know the next line? The next line is, this is our house, we make the rules. So with a public hospital district, we can make the rules, we can set the agenda for our local funds and how we want to fill the healthcare needs and gaps in our community. The second line, my wife and I were talking about this event today, and one of the things she said that she thinks should be a goal, and I agree, is to build a system that we love and that we're proud of. So come join us and let us know what you think we ought to be working on. Thank you.
Thanks, guys. We had several questions from the programs committee, but to be honest, I learned a lot about public hospital districts today, and so some of these aren't quite as relevant. One question that comes to mind is you talked about the transparency and how a public hospital district can increase transparency. The structure of it the initiative going on a ballot. how much transparency is going to be disclosed to voters on what the needs that you identified, like youth mental health, elder care, substance abuse. There's certain things I think a lot of people would have broad community support for, but there's other things that might be a little not as much support. Are you going to, if it was on the initiative on the ballot, is there going to be, guardrails in place, like implied in a charter, that would keep it from having a mission creep, so to speak, that it could be true to what the voters would vote on?
Do you want to talk
Well,
about that generally?
I'll answer the technical side of it. You get to answer the political side of it. This is why I tell you I worked for Congress for 12 years, so I know how to ditch a good question. So technically, let me tell you what you're going to see on the ballot. And what you're going to see on the ballot is shall the residents of Whatcom County in this it'll have some geographical area around it, create a public hospital district for the purpose of providing health care to district residents. It actually is going to be very broad in technical words. Where that gets promises made, promises kept, really comes from the work that John and the other folks are going to do when they say, this is what we're going to do. And when people run for the commission, when they say, this is what we're going to do if we're elected. One of the things I would caution about, you could have a ballot language that said, we're creating a public hospital district to build one clinic in this spot and this dot. You can be very specific. However, it is incredibly difficult to get rid of a district. And so think about these districts. The oldest district in the state is King County, number one, and it's been around for 80 years. And so think about what's sitting in Renton and Valley Medical Center today versus then. What happened back then is they created a small little emergency room for an outlying community from Seattle. So technically, it's going to be a very broad language, but I do think that the political side of that, of really the value proposition that's put to folks, here's what we're going to get for our taxpayer money, is really up to what's presented to you and to those commissioners that are going to be elected.
I agree. I think a lot of it is up to those first commissioners and making sure we're electing good people, as Matt said. So that would be the other part of this work. If you're interested in being a public hospital district commissioner, we want to talk.
The pay is pretty awesome.
The other parts are the transparency pieces. The new district would be subject to, just as county government is, everything around the Open Public Meetings Act. So all of their meetings would have to be open to the public. They would be subject to public records requests and public disclosures, and everything they would do would have to be transparent and accountable to the public. And elections bring accountability. These folks would be up for election every, is it 4 years? 6 years, 6-year terms, like the Senate, like U.S. Senate. So that's the other part that brings in that transparency and accountability, where the community can hold that board accountable.
Are you aware of like other public hospital districts? Do they operate under a charter like our Whatcom County government does, that clearly identifies the roles and responsibilities of commissioners and then the chairperson or the CEO, so that there's an understanding on how
Sure.
that structure works?
So public hospital districts, again, they're self-governing, so they can choose to do so. Most public hospital districts, if not all, they adopt some sort of bylaws to operate under, which can also be called a charter. But again, they're self-governing, so they can choose themselves to what that says. They are accountable to the public, whether they get it wrong or right, both in election and in public hearing. So the answer is yes, but it won't appear on the ballot itself as a technical matter.
And Matt, I think the other item is state law, right? State law has some rules and constraints.
Yeah, so once you are elected a public hospital district commissioner, you have a certain training requirement. And the training requirement is specific to the Open Public Meetings Act. You went through it when you were elected to city council and to the Public Records Act as well.
If anybody is interested in a deep dive and digging out and geeking out on this issue, on the website for the Association of Washington Public Hospital Districts, there's a legal manual that dives into a lot of the details around governance for a hospital district.
I think what we'll do now is open it up to some audience questions. We still have several questions that we could come back to, but I'd like to hear from the group here. So Jane, are you going to be our mic?
Yes, Jane and Jane.
Jane and Jane, Jane with a Y.
One question over here. This is from Dr. Wilson.
That was great. My question relates to access gaps in primary care and health insurance. Our experience, and I have to say the experience of a number of our neighbors, is that either primary care practices locally are full, or more concerningly, they don't take Medicare or they don't take Medicare Advantage plans. And so I guess my questions are, is that something that has come to the attention of the health board? And also, would a public health district help to ameliorate some of those gaps that have been identified?
So I'll start with the technical side. Now, this is where I get to correct people all the time. It is a public hospital district, not a public health district. And that gets confusing a lot. You already have a public health district, and John's on the board, a public hospital district. So a public hospital district does have slightly, if they were to operate a hospital, quite frankly, they operate under a hospital operation license just like anybody else does. If you operate a clinic, you operate it just like any other clinic in the state. Think of it this way. You're not I hate to use this term business, but a clinic business or a nursing home business, hospital business. You're not a provider who happens to be government. You're government who runs a provider. And so all those overriding government regulations trickle down to you. So if you think of what the University of Washington has to do when they provide Medicaid or whatever, that would trickle down through the district as a government-owned provider. Same thing with employee issues when it comes to laws around union labor. When it comes to laws around purchasing and contracting, they have to behave just like the State Department of Transportation. And so I know that's a ubiquitous way to getting to that. Now, if the district itself chose to adopt a policy that said, we are going to service charity care or Medicaid patients or Medicare patients in a way that exceeds the regulatory minimum, they certainly could.
I'll add to that. The other thing that a hospital district can do is support the existing system. So to have those conversations with current providers to learn about where is it that the healthcare marketplace is not meeting current demand, and you'd have a local subsidy. So this would be a way for a hospital district would contract or grant with local healthcare organizations, nonprofits to say, hey, where are those areas that you can't fill those gaps? Here's an area where a public subsidy via the revenue that comes into a hospital district could help to fill those needs and gaps.
Jane, you got a question here you got to go for?
Hi, I've worked in Whatcom County for almost 30 years as a healthcare professional, and I've seen lots of changes over that time. What would a public hospital district have to, would they help to mandate the competition of expensive equipment like DEXA scans, CT scans, MRI scans, where I saw competition among the providers to offer this, and now it's dwindled, and now there's like one or two. Is there any mandate that would fit under?
Absolutely not. A public hospital district, when they choose to open a clinic, hospital, nursing home, any of the above, they operate in, quite frankly, a competitive market like any non-government entity. Again, they're a government that happens to run a business, and that business has to operate in a competitive market.
Could we, Jane? Okay, go ahead over there, please.
I think you have two Janes to choose from. We're going to do Jane Fredmer over there is going to do that half the room, and I'm going to do this half.
This is very interested and informative. Tim Douglas. At the same time, there can always be downsides. Can you give us two examples of where a hospital district, as you described it, has stumbled and created problems rather than helping solutions?
Sure I can. I will say that the biggest challenge of public hospital districts is the funding is not a panacea. And so when you are operating in a competitive healthcare market, which is very, very low margin, very, very difficult to operate in that environment, particularly today with and what we're facing on the federal side that John so aptly described. The amount of taxpayer money you get, I would say about half the time keeps you stable. The real benefit of a public hospital district financially tends to be the ability to go and get bonds for capital projects rather than the levy. Where they have faltered, and many have, it's been due to bad governance. It's because they've had commissioners elected with agendas of, if I get elected, I'm going to close this hospital. If I get elected, I'm going to fire the CEO. If I get elected, I could tell you story after story. We actually have a current commissioner in the state of Washington who was elected on the premise of moving, and this is a good-sized $100+ million hospital, elected on the premise of moving the financial structure of the hospital to the gold standard. And I don't mean performance. I mean bricks in the basement backing the finances of the hospital. You fall victims of democracy sometimes. So if some turkey gets elected, they can be very destructive to a district. And that is probably the number one area we see, and that's a vulnerability for districts.
So Tim, you want to help us recruit candidates?
Jane, can you, Jim, go grab Jim over there, please?
He's been waiting up front here. So,
my question is, what if it's a 6-year term for the commissioners? Do they get staggered? And if so, do the initial ones then end up being elected to 2, 4, and 6 years, for example?
they are staggered to begin with, yes. So the first one to sign up gets lucky. His arm's going to fall off if we don't give him a microphone.
We'll go here first. Yep.
Thank you. My question is about, are you thinking a discrete part of Whatcom County as the hospital taxing district, knowing that Point Roberts already has a hospital taxing district, so they probably would not be part of that. And I'm here representing Lummi Island Health and Wellness, which is a nonprofit that assists islanders with health-related issues. So how would you think you would look at the county with a hospital taxing district?
Thank you, Pam. If anyone hasn't seen the work of Lummi Island Health and Wellness, we had a great presentation in October to the Board of Health, and you all have a great website. Adding on telehealth medicine care on the island, which is a big need. We're thinking about going, the group that's been pulling this together is thinking about going as large as possible, which would be every part of the county but for Point Roberts and the far, far east Whatcom County, which mostly the voters are the Seattle City Light workers at the dams in New Haven. So everything in between to help, because that need it's there all across our county.
You're not legally allowed to overlap two districts.
I think we'll have time for two more questions, I think.
Thank you. Question one each for both of you. Matt, can you give us an example of a situation in another part of Washington where a public health district was formed, where they had a Peace Health-like situation like we have here, and what transpired, and if there's a roadmap that we can refer to? And John, or Councilman Scanlon, sorry.
I'm John to you.
I'm
John to everybody.
It sounds like we do need to scale up the care across the board. There's lots of talk about St. Luke's, and could the hospital district, if it existed, purchase that property and then to expand capacity for the Unity Cares and like take ownership of that building? Is that something that would be permitted? Matt,
Legally, yes.
Okay. Those are my questions. Thank you.
I didn't want to take John's question, but legally, yes. I'm not going to answer the politics of that. To your question about has other examples around the state. I'll speak specifically to Peace Health and where they coexist with districts already, and these are districts that don't have hospitals. owned by the district. In other words, there's not another hospital. So down in Sedro-Woolley, that is operated by Peace Health. There is an underlying district that has significant revenue from their taxpayer. In fact, they're going to go out for a levy lid lift here. So if you have friends out there, tell them to go support that. And so what they coexist, and they have an agreement with each other about how they flow funds to each other. Same up on San Juan Island. The Friday Harbor Hospital is operated by Peace Health, but there's an underlying district that has an assisted living. They have an EMS district that is actually a hospital district. Again, we get confused with names here a little bit. And what I can say in those two instances, I got to take a moment and say what a absolutely outstanding partner Peace Health has been with them. One of the advantages I would say here in this area is regardless of the future nexus between Peace Health and a district and how you choose to interact with each other, you have somebody in the neighborhood who has a lot of really good experience in those models. And I'm talking about governance. And I'm talking about how they respect and work with an independently elected board and operation, and how they flow that information together. I would say around the state where these nonprofit and PhD coexist, the way they've built out in those other two districts are some of the best in the state. I can't give you an example of where a district has been created where they've gone and hugged around an existing hospital with such sophistication as St. Joseph's. Most of them have gone the other way. The hospital has been grown up by the district and then either spun off from the district or otherwise.
I'll just add to that as well. Thank you, Andrew, for the question. There's another group that some of us have been talking with in Kitsap County, where they're looking at a very similar model. Kitsap County has very similar demographics to us around population-wise. We're pretty similar. And it's also a county that has one hospital. So they're looking to add access to rural healthcare in that community. Selena and I had a good conversation with some counterparts in Kitsap County just this week to learn from them. They're looking to put that on the ballot this year, so we can learn a lot from them. And I think in the future, if this goes forward, is we're going to need partnerships. And I know where the community's at on some things with our one hospital, right? There are other mechanisms. Owen identified some of them in an article in October or November in Cascadia Daily looking at the Certificate of Need program. The state Certificate of Need program is one of the largest barriers to going back to having two hospitals in our county. There are other things that can be done at that point that if folks are interested in that, that's a good place to look, and our state legislature would have to take action on that. Or significant population growth. There's only, I think, 3 new hospitals built brand new in our state in the last 15, 20 years that I'm aware of. Swedish Issaquah in East King County, growing massively. The Auburn Hospital, I think, was maybe early 2000s or so, and then Gig Harbor. So these are areas in counties that are growing at much higher rates, or we're growing at much higher rates than ourselves. We would need massive population growth probably to be able to get through that Certificate of Need process. On acquiring facilities, yeah, that's something I think a public hospital district could do. And so, for example, I've had conversations with Councilor Barry Buchanan, my counterpart as an at-large member on county council. And a few years ago, he was working with folks to try to get a clinic in East Whatcom County, and they were looking at properties in Deming, in Kendall, in Maple Falls, and they couldn't make the project pencil out. And so part of my thinking on this as well, a public hospital district through that local funding could provide that subsidy for a project like that the healthcare marketplace can't provide. It could help that to pencil out.
And I'm sorry, I apologize. We do have time for more questions. We have till 1:30, so.
Can we see all hands who have questions so Jane and I can map this one out?
Matt, this one is for you predominantly, but both of you. I'm really excited about what you're talking about, but I'd like you to explain. We have 58 districts, so we do have people that are currently taxing themselves to pay for these services. So is that information on your website, the range of the districts and exactly what they are collecting? And could you explain to us the mechanism of how it's charged? And then can you leverage your money in the district to get federal funds brought in that are not currently here? But the main mechanism is, how is it charged? Property tax?
Yeah, but really good question. So if you go to awphd.org, we actually have an interactive Tableau map where you can see them all around. I think I was telling John earlier that in Grant County, they actually have 8 districts. Some of them have a lot, some of them have county-wide districts, so they really do vary. The way the money is, we're what's called a junior taxing district. We're a special purpose district. And so a public hospital district, assuming they're not doing just EMS, is allowed to go up to 75 cents per thousand. And that cap, for those property tax nerds in the room, if you look at like you see a DNA strip band that has like the black and gray. So the county takes this much, the city takes this much, then the juniors are kind of left to fight out the rest at the bottom. We're allowed to take 75 cents of that. Around the state right now, the average public hospital district takes, I believe we're up to 43 cents. However, in the past 5 years, we're very involved in assisting districts with their, talking to their residents about that support. In the past 5 years, we've had probably almost 30 elections, and they've all gone up to the full 75 cents. So it's a property tax. And yes, you absolutely can leverage federal funding.
And to add to that as well. There you go. Is that back on or no?
If the battery runs out, it means we talk too much.
I'll talk into this one here. If the state legislature allowed us another option, I would go for it. And I say this the same thing in county government. Most county government, city government, local special districts are only allowed to do property tax, sales tax, and fees. And we're having a really good discussion across our state about progressive revenue against regressive revenue. And our state legislature is debating this right now. If there was another mechanism, I'd go for it. This is the mechanism that is currently in state law.
And I'm going to start working my way over to that end of the room because I think this room's pretty happy.
Yes.
No? Okay.
All right, thank you. I am curious if any of the public hospital districts have kind of nonprofit foundation arms, like Seattle Children's and Peace Health have that foundation side. Is this common in the hospital districts?
It's very common to have a foundation, particularly if there's a hospital. There's a few that are just have clinics or a nursing home that do have a foundation. They have some restrictions that nonprofit hospitals with a foundation don't have. An example is if all the commissioners, they can't go serve all together on the foundation board because it becomes a public meeting. And so there's some of those nuances to work through, but yes, they do exist and they're wonderful.
Can you comment a little bit on any conversations between you and Peace Health on this issue?
Yeah, is Chuck or Rachel here? I think I see Rachel in the back. I've talked about this with Chuck Prosper and Rachel Lucy in leadership at Peace Health, and also with a lot of the other healthcare leaders in our community from Family Care Network, CMAR, Unity Care, and others. I think you've had conversations as well.
Certainly.
I'm right here.
Anything that came from that?
Thank you.
I find that people want to partner. I mean, I'll let others speak, for themselves about what they see, but I find people want to partner because that's the example from other PhDs across our state is there are partnerships between the public hospital district and local healthcare entities.
Right now, I believe today, it's there's a vote in committee in the Washington House of Rep to establish a board for universal health care in Washington. How would PhDs be able to work with that? How could a legislation establishing universal health care in Washington, which is a much larger polity than many European countries with excellent independent universal health care systems, how could we work together to strengthen the role of a public public health district, hospital district, how can they interface? And do you, in pursuing this avenue, plan to strengthen that other avenue as well and work with that?
Well, I can just, from a technical standpoint, if the bill were to pass, and that was a public policy of the state of Washington, the public hospital district would be obligated to follow it. And it's as simple as that. I think it really comes down to the nuance of what line of providing healthcare the district chose to do. If they're choosing to do like they do in Verdant, where they simply give out grants. And so they'll give a grant to the senior nutrition program. They'll give a grant to the CPR classes for junior high schools. And so, that probably wouldn't apply there if that's what your mission is as a district. If your mission as a district is to operate a clinic, then most certainly you would participate under the rubric of universal health care, let's call that would be created under that legislation. Of course, if you are a direct provider and you're managing that as a district, just like a hospital or anybody else, you are beholden to the federal insurance, Medicaid, Medicare laws, whatever they may be. And so really you operate under the rules of what it is you are. So really the district structure itself doesn't play much of a role in that. And so, but you do have the ability to do work, again, under that provide for the healthcare of your district.
I think, Matt, isn't it the stat out there that when hospital districts operate a healthcare entity such as a clinic, if a public hospital district were to operate a clinic, the majority of the revenue is normal healthcare revenue. It's Medicare, it's Medicaid.
Absolutely.
And it's private pay insurance. So if there was a change at the state level, and let's say we had a public hospital district running a clinic, that would then be one of the revenue sources for that clinic would be that new system.
Yeah, it certainly would alter the revenue model.
She was not asking about the revenue model, but the politics.
Well, that's up to your newly elected 5 commissioners.
I'm asking you guys where you stand on healthcare and how you would work to, whether you would work to cooperate with that as it.
Okay, let's put the question to John because he's. How would you cooperate or not?
Big supporter.
Okay. Well,
I've lived abroad. I've lived in other countries. I lived in France. I lived in Japan. I've seen how healthcare works in other countries, and I've always been a big supporter of universal healthcare. And yeah, if that goes forward, we're going to find ways to partner.
Hi there. Thank you both. This has been really great. Matt, I had a question just as kind of an academic lecture style question. You mentioned that it's not really practically feasible to build a new hospital, but it is totally there, available to us within the system that exists, correct?
Within the authority, yeah.
What about if a hospital went under and it had to be taken over? Is that feasibly possible under the same system? Like if you created a hospital district that had in its bullet points,
Absolutely. And in fact, I'll give you a real world example where that happened, but on a more micro scale. When they created the district on Vashon Island, one of the reasons that they created it is because Neighbor Care was running the only clinic on the island, and Neighbor Care was about to leave. And so they went in and said, hey, we're going to come in and create a taxpayer revenue model that allows us to incentivize a partner to keep that open. And that's essentially what they did there. And so whether you're acquiring physical space or whether you're assuming a business, I don't like to use the word merger or anything like that, but as long as you are doing it for the benefit of healthcare of district residents, you absolutely can do that, yes.
Thank you.
All right, I had
This is a political question, so mostly yours, John. I think that your initial plan of including as much of the county as possible is a good one, because all the money for where the taxes will come from is in Bellingham and close environs. My question is, assuming that we have this proposal on the ballot, which includes the creation of the district and a levy amount, presumably, and farther down the ballot, electing our commissioners. Why should the people of Bellingham, and with the understanding that we all just received our tax statements,
Yep.
And the social media is full of complaints, why would we in Bellingham support a public health district that is almost certain to begin operation in the county when the county votes down property taxes?
That's a good question. Thank you, Dan. And I think that's because we also have healthcare needs in Bellingham. I've seen that in my own life. So what we could do with the district is I feel like a public hospital district across Whatcom County should serve multiple parts of Whatcom County and not just one part. We know that there are needs in East Whatcom County that are being documented. There are needs in Bellingham as well. Some of the things that we're doing at the county level, I did mention earlier things around behavioral health care, adding in that new facility in the Iron Gate neighborhood. There have been other expansion of programs, but we all see the need in our community when it comes to behavioral health, when it comes to mental health. The data I talked about earlier about youth mental health in schools, that's across every single school district in our county, including Bellingham. And some of the state and local funding for school-based mental health is going away. So those needs are there across the county, and I think a PhD should be there to support multiple parts of Whatcom County, not just one.
I have a timeline question. If indeed this were to move forward with what you're working on, Dan, how long would it take to get to signatures gathered, election held, commissioners named, public hospital district in operation? What's the 0+ day or month timeline for something like that?
Probably the earliest would be 2027 on the ballot. So potentially looking at signature gathering starting about this time next year. And if that goes through, if there's enough signatures, getting it on the ballot potentially for November of 2027 along with those commissioners. It's probably a little too late for this year. Plus it's a crowded ballot being a midterm election year. So potentially 2027 would be the earliest. And in some of the conversations that a few of us have had, we're really tracking what's going on in Kitsap County because they're looking to go on the November ballot this year. So learning a lot about their process and how that goes. Right, so it would start then in 2028.
There's one little hitch in your giddy up here, and that's the once it's created and the levy rate is set, you have to go through one cycle, a property tax cycle, before you get the money, and then there's actually a waiting period under state law. There are ways to mitigate that. You can actually go out as an established district. You can essentially get a loan against future funds, but there's a little delay in funding that happens there. So, there's not, no one's driving Cadillacs on the first day.
We have another question over here, and then another one here, and then I'm going to work my way back over there.
Thank you. So my question is rather a broad question, and that is, if this is our house and we make the rules, at what point do we get to enforce that no taxation without representation as a rule? Why would we want to support or fill the gaps of the existing system if it's demonstrated itself ineffectual repeatedly? Like, at what point, if the federal government is taking our taxes and not using them for what they're supposed to use, when would we actually start to coordinate more of an effort on, like, rebelling against a government that is, like, hostile to the people it represents as a primary solution, rather than adding what seems to me like Band-Aids to a gaping wound?
Well, from a technical matter, I'll just say that while there's 535 bandits back in Washington, D.C., there's only going to be 5 in a district. And so if you want to change the course of a public hospital district and how they are taxing you and how they're utilizing your taxation, which, by the way, a levy rate is an up to amount. So if a district, let's say 3 new commissioners are elected, where they change the ethos of those individuals elected, and they choose not to take a levy the next year, they can. And so really the ability, and because as this gentleman's question pointed out, the staggered nature of them, turning over a public hospital district commission is actually pretty effective. And so if you're not feeling that your taxation needs are being held responsible or in a way that you approve of, you really do have that self-governance ability in a way that I don't think exists and we feel in a lot of areas of government.
It's add that on the no taxation without representation, that wouldn't be the case here because the voters of the district get to choose. Do they want this to occur? Do they not want this to occur? And then elect the commissioners and then re-elect or kick them out every 6 years. Well, actually, every 2 years, someone would be on the ballot.
It is worth noting that 5 commissioners, we'll assume there's going to be 5, they cannot raise your tax rate without going to the voters. Stop, period, new paragraph. They cannot say, oh, our levy rate has creeped down to 40 cents, I want to put it back to 75. They cannot do that without coming to the voters.
Okay, we cannot hear you. We're going to move on to another question, please. Sam?
All right, Mike's back on. Thank you. I guess I have a bit of an if-then question. I'm curious, Matt, you said something about 30 elections recently, I think, something like that. I'm curious if there is a trend toward creating public hospital districts, and then if that is the case, if you'd give any insight as to maybe why that's happening, either statewide or nationwide.
It's a mixed bag. I'm going to say that where we are seeing them created, they are tending to be created to meet a very specific need. An example is Toppenish just created one. Because in Toppenish, the hospital used to operate a labor and delivery there, and they stopped operating labor and delivery. It was an economic question. And so they created a public hospital district to try to fill some of that need. I'll be honest with you, I don't think that need's going to be filled by the district. I think they made some assumptions. They didn't myth bust enough with their voters. But they have a district now, and they're going to be able to do some things there. Hopefully create some partnerships. In Vashon Island, clearly it's an island they needed something. What we are seeing is that in the larger a hospital gets, the less they want to be a district. And the benefits of being a district, the tax revenue, let's set aside the benefits of transparency and community ownership, which are somewhat altruistic. But that 2.2% of their revenue that they're getting, quite frankly, doesn't offset some of the challenges that comes with being a government agency or a unit of government itself. And so we're actually seeing more districts getting out of the complex nature of running hospitals and doing exactly what I mentioned down in Edmonds and in Arlington and over in Sedgemoor-Woolley, saying, hey, you hospital pros, you go run a hospital because that's what you do really well. And we're going to constitute ourselves into a community organization for healthcare that does everything else. We actually had a district in Kennewick that operated a very, very large hospital that went bankrupt because it is such a challenging environment. So what they did is through the bankruptcy is they spun off the hospital operation to a nonprofit folks that are now running it. And now that district underneath is coming back, and they're going to do the things a lot like you're talking about here today.
Can we have a show of hands, please?
I had a question relative, you talk about the commissioners getting on the ballot, but how do that first slate of commissioners get identified?
They are, that first slate, they get on by petition as well. They'll be elected at the same time as the district is created. They'll be on the same ballot. So anybody can run. Now, one thing to be cautious of is it has to match the proposed district. If the proposed district has sub-districts, in other words, you have to live here, here, and here, then of course you have to meet that requirement. If the proposed district on the ballot is an at-large, which most are and we recommend, then anybody can sign on. And the only restriction to being a hospital district commissioner is you can't be employed by the district, which in this case would not be an issue.
And I think the others, you got to be a registered voter in the district, so 18 years old, living in the district. And I think it's a little bit different, am I correct, Matt? For example, for most offices, for example, anybody looking to run for office this year, there's a filing week in May, and it's 5 days long. But for hospital district commissioners, I think it's a 3-day window. Is that correct?
It's a little bit of a different window.
Yeah.
I think we're about to wrap up. We have one more question, and then we're going to look forward a bit.
I hope this one's for John.
Well, the underlying goal is good, to have an incremental improvement in healthcare. We have this limitation. What is the? You didn't really talk about the percent of the person's property tax that would be going to this is 2 or 3%, is it, or 5% of the property tax bill, ultimately. And so all we can do is an incremental system, it seems like. And I don't know if there's a push, I think, in the state legislature to do an income tax, because, you know, our property tax system was developed 120 years ago when property was all we owned. And now it's only a small proportion of what we own. And the number of people who make $1 million a year in Whatcom County is larger than you think. I've seen some of the tax returns years ago. So we need to work on that.
So I would respond this way, that unless there is a redesign of the state property tax system, we have to operate in what we have today. You're not taxed on a flat percentage. You're just taxed on that 75, let's say they ask for 75 cents per $1,000 of value. Now what happens is next year, if your property value goes up, your rate goes down, because they're going to come and say, we're going to ask for 75 cents gives us, I'm making up numbers here, gives us $10 million, okay? So next year, they're going to get $10 million. The year after that, they're going to get $10 million. That stays flat and static. But if your property value goes off, for them to get the 10 million, you only got to pay 74 cents, 70 cents, 60 cents. And that's why they ratchet down. They still get the same money, your school, your fire district, whatever. That's why it's hard to say it's a percentage, because it's whatever it takes to get that approved dollar bucket amount. And that does fluctuate. And typically what we've seen in areas with high property value growth, that rate can collapse actually rather quickly.
Thank you, everybody. Oh, sorry, Joe, do you have one more
just
comment?
the other thing I'll add, and kind of relates to the other question earlier. Yeah, we're dealing with a failing system, right? Our federal government is failing us. They've been failing us for a long time on healthcare. We have so many members of Congress. There are elections this year. We can vote them in, keep them in. We can vote them out. We can advocate for change at the federal level. We can advocate for change at the state level. But this is a way for us to do something locally that we control. And yeah, it is plugging a hole in that failing dike, but it's something we can do. And I'm about solutions. That's why I ran for office. That's why I step up to do these things, is to find solutions. I'd love to hear about other solutions. I've been in conversations with a lot of folks in this room about what else can we do with those changes we're seeing at the federal level. And there's a lot of really good thinking going on in our community about other things that we can do to have a better healthcare system.
Thank you, guys. As we conclude our program, we're going to have a couple closing remarks. If you can just hang, Allison, if you or Jane.
Yeah, I'm going
Thank
to
you.
start with thank you. And Garrett has a couple little things for our speakers, but I want to give you some highlights about coming programs. And in March, it's going to be the economy. It's the economy, stupid. Hart Hodges and James McCafferty will tell us what we need to know about what's going on with the broader economy, and they've also done a very deep dive into what's going on here in Whatcom County, so that's March. In April, we are working on a program on the Nooksack River flooding, looking at both mitigation and or prevention, and we'll have some experts talking about the technical stuff, and Mayor John Perry of Everson will join us to talk about the people side, the impacts that those communities are living with. In May, we're going to do the New World Order. As you may remember, Canada's Premier Mark Carney talked about a New World Order as things have changed. And what does that mean? First of all, what does that mean? What's Canada's role? And particularly looking at our interdependence of our economies between BC and Whatcom County. So we'll do that in May. July, we're going to talk about authoritarianism from a historical standpoint. And as John referenced, we have a very busy election season coming up, including the prosecutor position, the 42nd District Senate position, the expansion of the port, a bunch of initiatives. So we will be doing some programs on that to get you folks up to speed as to what the issues are and who the candidates are. And I want to give a shout out to members. I see several members here who participated in our focus groups. And I thank you. You gave us some great input. And one of the inputs was, can we make those election forms a little bit more interactive? Good question. And we're going to try and see what we can do in that direction. And I want to thank all of you for coming. I see a lot of tags that indicate people aren't members. To the members, I thank you. As Allison said, we rely on our member fees to do these programs. To non-members, we invite you to join and invite you to come back, because as you can see, we have a whole lot of programs coming up. We are not going to run out of things to talk about. I can tell you that. So please join. And I also want to thank Garrett, who moderated today, was the other Jane, or Jane over there, and Jill Bernstein worked on this program for months to put it together, and thank our speakers because they put in a lot of time and thought to do this. And Matt came up from Seattle to join us this morning. So thank you very much. We really appreciate it.
Oh, thanks, Garrett.
Thank you so much.
All right, everyone. The room's really crowded, so be careful as you're leaving. And if you could bust the tables, that would be awesome. And there's a really quick and easy QR code on the table tents that also acknowledges all of our wonderful sponsors. Please give them a round of applause for their support as well. Thank you.